My name is Mary DiRuzzo, and this is my head-to-toe assessment video. This is Layla, my volunteer. We've done a full set of vitals, checked her height and weight, checked her distance vision with the Snellen chart, and her near vision with the Rosenbaum chart. I thoroughly washed my hands. She has on comfortable clothing, and we will now begin. We'll start with inspection of the face. The face is symmetrical. The head is normal cephalic. We will palpate the scalp, noting that it moves freely, that the hair is evenly distributed throughout. We'll palpate the skull, noting that there's no indentations or lesions. We'll come around and check the temporal mandibular joint. If you can open and close your mouth twice, please. Very good. Noting no pops or clicking in pain. We'll check the facial bones, no pain. We'll check the frontal sinus for pain or swelling, and the maxillary sinus for pain or swelling, of which there's none. Then we'll check the cranial nerve function. If you will please scrunch your forehead, relax, squeeze your eyes tightly, relax, smile, relax, stick out your tongue and wiggle it from side to side, relax, puff your cheeks, and then clench your teeth, all noting normal cranial function. If you close your eyes, please, and we'll check for some light sensation. Tell me where you feel this.
Forehead, cheek, chin.
Very good. Noting that light sensation is intact. Then we'll examine the eyes, noting that the hair of the eyebrows is even in distribution and extends to the outer canthus of the eye. We'll check for eyelashes that curve away from the eye. We'll check the sclera, which is white, the conjunctiva, which is pink, the lacrimal apparatus, which is intact with no drainage. If you please pick a spot on the wall and take your right hand and cover your right eye, and we'll know that there's no nystagmus and no facial tics. Put your hand down and do it on the other side, please. Noting no nystagmus or facial tics, you can put your hand down, please. We will then check for the 6 cardinal fields of gaze. If you'll keep your head still and follow this. Noting that the eyes move fluidly through the 6 cardinal fields of gaze. Then we'll check for pupillary response. We'll check, look straight ahead, please. For direct and consensual, and again, direct and consensual, noting that the pupils are equal, round, and reactive. We'll then inspect the nose. The nose is midline. We'll check for patency. If you could press one side of the nostril and breathe in, and do it again on the other side, noting that the nose is patent. Then we'll inspect the nasal turbinate and the mucosa, which is pink and moist, and the septum is midline on both sides. Okay, then we'll inspect the ears. The ears are symmetrical. The pinna has no pain, no tenderness, no masses, no lesions. We'll inspect the tympanic membrane, which is pearly gray. There's no edema or swelling or drainage. We'll inspect the other tympanic membrane. It's pearly gray, there's no drainage, no edema, and no swelling. And we'll then test her hearing. We'll do the Weber test. I'm going to strike the tuning fork and place it on the top of your head and see if you can hear the sound equally.
Yes.
Okay. Then we'll do the Rinne test. We'll strike the tuning fork and place it on the mastoid process. Tell me when you can no longer hear the sound.
It's gone.
And then in front of the ear?
It's gone.
Okay. Noting that air conduction is 2 times longer than bone conduction. Then we'll do the whisper test. I'm going to whisper a word and you tell me what you hear.
Dog. Onion.
Very good, noting that the hearing is intact. We'll then move down to the neck. Oh no, we'll move to the mouth, noting that the lips are pink and moist. There's no cracks, no lesions. Can you open your mouth, please? And we'll inspect the teeth. They're normal in color and characteristic. We'll note the hard palate. Open your mouth and say ah, stick out your tongue. Soft palate, uvula, tonsils, tonsillar pillars. The tongue is pink and red. Normal in color, can you lift up the tongue? And we'll look at the floor of the mouth, move your tongue to the side. Then again, the other side, noting no lesions. And then one more time, say ah, and we'll do the gag reflex. Okay, sorry about that. Noting that the gag reflex is intact. We'll then inspect the neck. Noting that there's no jugular vein distension, we'll check the carotid artery. Noting that the rate is regular and even and 2+, and we'll do it on the other side. Noting that the rate is regular, even, and 2+, and then we'll inspect the thyroid. Can you swallow? Noting that there are no lumps and nodules in the thyroid. We'll then listen to the carotid arteries using the bell of the stethoscope. Take a deep breath and hold it. The carotid artery rate is, the pulse is regular and even and 2+, noting no bruit, no thrill. And again on the other side. Regular rate and rhythm, 2+, no bruit, no thrill. Breathe. Take a deep breath in. And we'll listen to the thyroid. Okay, breathe. And there's no bruit or thrill. We'll then inspect the flexibility of the neck. If you can lean your head to one side and then the other, and then shrug your shoulders. Lean your head forward, and then flex it backward. Okay. Now I'd like you to resist. Push forward, push to the side, push back, and then to the other side, noting normal strength in the neck muscles. Then we'll look at the arms. We'll inspect the arms. The color is normal throughout. They're warm. There's no bruises, no lesions. Noting brisk capillary refill to the fingertips, and nail beds are pink. We'll check the brachial artery, which is 2+ and regular. The radial artery, which is 2+ and regular. Again, on the other side, the brachial artery, which is 2+ and regular. And the radial artery, which is 2+ and regular. Okay. Then we'll check for the lymph. We have the tonsillar lymph, the submandibular lymph, and the submental. We have the preauricular, postauricular, the occipital, posterior cervical chain, the anterior superficial cervical chain, and the deep anterior cervical chain. We have the supraclavicular, and we have the axillary inframammary. There's no lumps and nodules noted. Then we'll have you turn around and we'll inspect your back. Noting that the back is symmetrical. I'd like you to take a deep breath in and out. Okay. Noting that expansion is symmetrical. My hands open evenly. We'll check tactile fremitus. Take a deep breath and say 99.
99.
Again, breathe.
99.
Again.
99. 99.
Very good. Noting that there's good air excursion throughout. We'll then palpate the back for any pain, lesions, masses, and then we will percuss the back, noting normal resonance throughout. Okay, then we will check for diaphragmatic excursion. Take a deep breath in and out and lean forward. We will percuss until we hear a sound change, which is here. Okay, take a deep breath, sit up, I'm sorry. Breathe in and out twice. And then lean over. Okay, and we'll percuss up till we hear a sound change. Okay, sit up and breathe normally. And that's the area of diaphragmatic excursion. We would do that on the other side. Then we will auscultate the lung fields. Take a deep breath in and out. Again. Going in a symmetrical fashion. Again. And again. Lift your arms up over your head. Take a deep breath in and out. One more time. And again. And one more time. Noting no adventitious breath sounds. You can put your arms down. Then if you turn around to the front, we'll inspect the lung fields of the front and the chest of the front. The chest is symmetrical. Respirations are regular and even. There's no heaves, no lifts. We'll palpate, and there's no masses, no lesions, no pain. And we'll palpate down here, the front. We'll check for the apical pulse, which is regular and even. Then we'll percuss the lung fields. Normal resonance throughout. Lift up your arms over your head. We'll do the anterior chest. Noting normal resonance throughout. You can put your arms down. Then we'll listen to the heart sounds using the bell of the stethoscope. We'll first listen to the aorta, the pulmonic, Erb's point, the tricuspid, and then the mitral valve areas. Noting that there's normal S1, S2, no murmurs, the normal cardiac sounds. We will then inspect the abdomen. Seat up here for me, please. Lift up your shirt. Okay. We'll first inspect the abdomen, looking for normal contours of the abdomen, any masses or lesions, of which there are none. Then we will auscultate the bowel sounds in all 4 quadrants, listening for 3 to 5 minutes, noting normal bowel sounds throughout. Okay. Then we will percuss the liver, the costal margin of the liver, and palpate. Then we'll percuss the splenic area and palpate. We'll lightly palpate the abdomen, noting no masses, no lesions. Then we'll deeply palpate the liver border and the splenic border, noting that we cannot feel the spleen itself. We can feel the kidney area, no lumps, no masses, no lesions. And then we will listen to the aorta. Noting regular rate and rhythm. And we'll come down to the renal arteries on both sides, noting regular rate and rhythm, 2+. The iliac arteries, noting regular rate and rhythm, 2+, on both sides. And then the femoral arteries, noting regular rate and rhythm, 2+ on both sides. We will then palpate the aorta, noting regular rate and rhythm, 2+. And if you can sit up for me, please. We will then test sensation. Close your eyes and tell me if this is sharp or dull.
Dull.
This side.
Dull. Sharp. 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 Dull. Dull. Sharp. Sharp.
Noting normal sensation throughout. We'll then check the popliteal pulse, 2+ regular rate and rhythm, and do it on both sides. The posttibial pulse, 2+ regular rate and rhythm on both sides. And the dorsalis pedis, regular rate and rhythm, 2+ on both sides. We will then check the reflexes, the brachial, the radial, brachial, radial. Fold your arms back. We'll check the patellar, posttibial, and all those are intact. Oh, I did forget to mention back on the chest wall, tactile fremitus. If you could say 99,
99.
99,
99.
99,
99.
and once again,
99.
noting normal resonance throughout. We did the pulses. Now if you could stand up, we'll inspect your back. We will note that their posture is normal. We'll palpate the cervical, thoracic, lumbar, and sacral areas, noting that those are normal. If you could lean forward, let your arms dangle. We'll check for any kyphosis or lordosis, of which there's none. There's no scoliosis. If you could stand up, please. And that's the end of my head-to-toe assessment. Thank you very much.